My name is Jasmine Hernandez, and I am a student here at Southwest University. And the project that I would be my project that I chose is childhood obesity. So obesity is an excessive amount of body fat, and in children, it is the CDC measures it by BMI, which is calculated with your weight and your height. Anything above 95 percentile, according to the CDC, the child is already considered obese. So, childhood obesity in the United States. In the year 2017-2018, about 14.4 million children and adolescents were already considered to be obese, which is a drastically high number. And unfortunately, with the COVID-19 pandemic, we were told to stay home, and kids weren't going to school. They didn't have their regular daily regimens. Their diets weren't managed well, and they were spending a lot of times indoors, and it caused childhood obesity to increase drastically in the United States. So we can see that childhood obesity is a bigger prevalence among Hispanic children, with 25.6% of Hispanic children being obese, which is a pretty big number, and it is relevant to us since in El Paso, Texas, it is a big Hispanic community, being a border city. We also see that it affects 24.2% of non-Hispanic Black children, 16.1% of non-Hispanic white children, and 8.7% of non-Hispanic Asian children. So with childhood obesity, we have the risks of children developing high blood pressure, type 2 diabetes, high cholesterol, fatty livers, muscles and joint problems such as joint pain, muscle aching. These are things that we would regularly see in the older adult populations, chronic diseases, and now because of obesity, more and more, we're starting to see it more and more in children. So epidemiology. Epidemiology is the study of scientific, systematic, and data-driven distribution and determinants of health-related states and events in specific populations such as schools, neighborhoods, cities, and states. So epidemiologists can study chronic diseases, infectious disease, and environmental issues. Chronic diseases, one being childhood obesity. So the principles are finding the frequency, seeing a pattern, and finding the determinants. So when you compare an epidemiologist and a physician, epidemiologists focus more on community-based care, meaning that they see a community as a whole. And with childhood obesity, they're going to look, let's say, at El Paso, and seeing the childhood obesity in El Paso as a whole, as where a physician is only going to see childhood obesity with the patients coming in to see their physician. And the plan of care is going to be based on every patient. So our population here in El Paso, Texas is about 974,000 metro area. We are a border town, and also we have Fort Bliss making us a military town as well. With the majority being Hispanic in El Paso, it is mostly Hispanic culture seen here. And we do see some different types of cultures because of Fort Bliss, but mostly Hispanic. So the majority of food in El Paso is Hispanic food, thanks to the border town, which is delicious. But that is mostly what you will see around here. The exercise regimens in El Paso aren't as great, as it is shown that the Hispanic culture isn't big on exercising. Both parents have to work and get home from work tired, and the last thing they want to think about is jumping on a treadmill or going outside to play. So children at a young age are already shown that exercise can be put off. So evidence-based practice is applying any research findings into our daily patient care practices. So anything that we do to care for a patient, we are taught to do it in such a way because it's been shown by research that it prevents infections, and it is for patient safety. So some examples are Foley catheters and central lines, clotting CLABSI. We are taught that in nursing school, and we are taught that when we start working as nurses. It is evidence-based research of how we practice inserting Foleys and how to manage taking care of them to prevent infections. And also central lines, we learn how to change dressings properly, how to access the central line so we don't cross-contaminate and cause infection in our patients. So what can we do to help our patient or pediatric community with their weight concerns? It all comes down to the parents, as they are still being taken care of by their parents. So the parents are the majority of the care. So physicians need to worry about communication. Communication is very important as the parents go and take their children for daily physicals. So if physicians bring it up, then it can raise awareness to the parents and can cause them to make that change. So motivational interviewing. This is a type of communication that a physician can take, and it is questions like, what does a child do during the day? What are they going outside to play with their friends? Are they spending a lot of time on screen time? What type of diet are they eating at home? Are they snacking a lot? Do they have fresh fruits and vegetables? So some helpful interventions is help families promote healthy behaviors, introduce parents to healthy foods, be supportive of parents, and also remind them that sleep schedules can help with weight loss. A lot of the times, parents are both working. They don't have time to make dinner, so it's faster to pick up fast food. And so it's important for our physicians and even nurses in the pediatric community to bring up these concerns and let them know that there is healthier options out there. Instead of choosing the burger and fries, maybe choose the chicken sandwich and apples or something different. So as we said, the plan of care, communication is very important. And it is, first, communication will bring up the awareness. We can conduct surveys to fill out on communication. Food, like we said before, the Hispanic community is very big on Hispanic foods, which is a lot of fried foods, a lot of tortillas, bread, carbs, all the good stuff. So short-term goals would be conducting provider surveys and the resulting survey. The long-term goals of this project would be monitoring and seeing a decrease in childhood obesity in the city, which will take time, and physically seeing less obese children. So QSIN is Quality and Safety Education for Nurses. The goal of the QSIN is to meet the challenge of preparing future nurses who will have the knowledge, skills, and attitudes necessary to continuously improve the quality and safety of the healthcare system in which they work. So the competencies of QSIN include patient-centered care, teamwork, evidence-based practice, quality improvement, safety, and informatics. So with patient-centered care, we need to recognize that the patients are the source of the control by providing compassionate care to all our patients. And we can tie this into childhood obesity by communication, again, communicating with them compassionately and making them aware of the problem and the risk that it comes with. So teamwork and collaboration is saying that nurses function effectively within their interprofessional team needs to have open communication, respect for one another, and shared decision making. And evidence-based practice, as we mentioned before, it's to deliver the optimal healthcare for our patients and family. And quality improvement is we use the data to monitor outcomes of our patients and seeing what we can improve with our patients. Safety is a big one. We want to minimize any risk and harm to our patients and providing effective and individual care. And informatics, we want to use technology since technology is everywhere now, and it'll help to communicate, mitigate errors, and support decision making. So I did my clinical rotation at a pediatric clinic, and it was very interesting to see that there was many obese children that would come in for their well visits. And the nurse practitioner that I followed, I was surprised to see that she took her time and showing the parents the CDC growth chart that they provide to them on their wellness visits and showing them how much their BMI has gone up since their last wellness visit. And if it had gone up drastically, she took her time, even though the waiting room was full and she was the only one in the clinic. She took her time to talk to the parents and let them know the risks and the concerns of the weight of the children. And her assessments, she looked for to make sure that they weren't pre-diabetic. She got labs for checking the hemoglobin A1C. For patients that we had a patient who was 19 years old and she had gained 20 pounds since her last visit and was already considered obese and she referred her right away to a dietitian, of course, with the mom there, and they're both agreeing that they would go to the dietitian and explained to them what they would do in the nutritionist office, saying that the child would go in 3 times a week and they would talk about food. They would show them platings on how they're supposed to serve themselves so they don't overserve, and how to choose healthy snacks. So I thought that was really awesome to see that she was taking her time and letting the parents know. And many parents that weren't aware did state that they would start making a difference. And she also wanted to see other parents come back to see if there was a difference being made in the weight. And if there wasn't, then she would then refer them to a dietitian. So I really enjoyed my clinical rotation. I saw a lot of how the community is cared for, the pediatric community. And I can't talk for all pediatricians or nurse practitioners that work with pediatric children, but I feel like where I did my clinical rotation, she really did take her time and did talk and explain to the parents about childhood obesity and the risks that come with it. So I'm really hoping that other pediatricians are doing the same, and hopefully we can make a change in childhood obesity. Thank you.